know how well a nurse knows her patient is by the way that she gives report. So I'm going to show you guys exactly how you should be giving a report. So you will see me giving a horrible report and you will see me giving a really good report. So I want you to watch for the difference. Okay, so I'm giving you Mr. Callion. He is like 28 years old. Let me see, did I write it down? No, he is 28 years old. He came in 2 days ago, maybe complaining of coughing. He feels better now. I don't know. He has an IV. I don't know where it is, but he walks around by himself. He got up and goes to the bathroom. He won't call you. He won't bother you. His doctor is... Who is his doctor? I don't know his doctor, but he's under family medicine. And yeah, do you have any questions about him? Mr. Callion is a 28-year-old male who came in 2 days ago complaining of coughing and shortness of breath. He was later diagnosed to have pneumonia. He's Dr. Bruschetta's patient under family medicine. He's alert and oriented ×3. His vital signs are completely stable. His lungs are clear throughout all fields. He is 98% on room air. Sinus rhythm on telemetry. His heart rate runs in the 80s. Mr. Callion gets up and goes to the restroom independently. He has no complaints of nausea or vomiting. Bowel sounds are present throughout all 4 quadrants. He voids clear yellow urine. He is tolerating his regular diet just fine. His skin is intact. He has no complaints of pain at this time. He does have a 20 gauge in his right forearm that has normal saline running at 100 milliliters per hour. His night was completely uneventful. He is presently right now watching television in his bed quietly. Do you have any questions for me? So did you see the difference between those 2 reports? One was very unorganized, lots of information was missing, and the nurse did not appropriately use the tools that she had. She had a clipboard, but she didn't write anything important down on it. The other report that I gave, the nurse had tools, which is okay. Most new nursing students use tools. I still use them. And her report was very coherent. She was able to fill in the gaps, and she gave you a great description of what the patient looked like clinically wise, and also what he was doing at the current time, which is important. So I want to show you guys tools that you can use. The first one is something like this, where you can write down your patient's name, diagnosis, and go through the systems, okay? So that when you give report, you have a system to follow, all right? And this is for a general description of your patient. And then this is one of my favorite tools. I still use this today. This tool actually has a grid at the top with hourly breakdowns, okay? So when I have multiple patients, if I have 5 patients, I can put patient in room, 21, they have to have an IV medication at 11 o'clock. Patient in room 36, they need to get up and ambulate at 3 o'clock. And this really helps me to stay on schedule no matter what happens, okay? So if you take about 10-15 minutes at the beginning of your shift and fill out your tools, they will be helpful to you throughout the rest of the shift. All right? So I hope you guys are able to give a much better report, and thank you for studying with me. This isn't NCLEX related stuff, but it's nursing stuff, and it will help you guys. So I will see you soon. Bye. Hey, if you want those tools to help with your report, just email me at remarreview@gmail.com.